Today, we will discuss a topic that many avoid, but is essential for sexual health: the inherent dangers of anal sexual practices. Prepare for a scientific and informative discussion that may change your understanding and perspective on this practice. Anal sex is a practice that can be common among some heterosexual and homosexual couples. However, certain dangers must be clarified based on the anatomical differences of this region compared to vaginal sex, for example. Before we begin explaining what can happen, let's understand the anatomy and physiology of the anal region. We know that the anus is the terminal part of the gastrointestinal tract, while the rectum is the final portion of the large intestine. Both are part of the gastrointestinal tract and participate in the excretion of bodily waste. Unlike the vagina, the anus does not have glands that facilitate natural lubrication. The wall of the rectum is a thin mucous membrane, unlike the vaginal wall, which is more flexible and robust. Considering this anatomical and physiological difference, any friction on the rectal wall and the anal area greatly increases the likelihood of lesions, abrasions, or lacerations. Due to this greater fragility, anal sexual intercourse presents a higher risk of transmission of sexually transmitted infections, for example, and some other complications when compared to vaginal sex. The vagina is anatomically favorable for receiving the penis during penetration and for guiding sperm to the woman's uterus for fertilization. For this purpose, it is rich in lubrication, and its wall is much more resistant and compliant. But let's identify the 5 main dangers related to these anal sexual practices. First, a higher risk of injuries. As I mentioned, there is an anatomical difference in the fragility of the rectal wall and the anus compared to the vagina. These facilitated abrasions, lacerations, or lesions can cause pain, bleeding, and local discomfort, precisely due to the lack of lubrication and the greater difficulty in penetration. Consequently, we have the second increased risk, which is the transmission of sexually transmitted infections. Given the ease of local trauma and laceration of this highly vascularized mucous membrane of the rectum, which can be, facilitated by anal intercourse, sexually transmitted diseases such as HIV, syphilis, hepatitis B, hepatitis C, herpes, and HPV can be more easily transmitted through these practices. There is another video on this channel where I explain each of these diseases and the inherent risks of anal sex involving each of them. It is well established, for example, that the risk of HIV transmission in anal intercourse can be up to 18 times higher than in vaginal sex. This is because the rectal mucosa, in addition to being highly vascularized, is rich in lymphoid tissue. This lymphoid tissue is the defense tissue where the viral load, HIV, is located. Therefore, when there is a lesion and laceration, the patient is potentially more exposed to acquiring a new HIV infection and transmitting it. Third, the increased risk of bacterial infections. As the anus and rectum are organs of the digestive tract, the gastrointestinal tract in its final portion, they are naturally colonized by various species of bacteria that, do not cause harm to the region. These are the bacteria that colonize the intestinal flora. However, these bacteria can cause damage when transferred to other parts of the body, such as the vagina, urethra, penis, or even the oral cavity. Thus, anal sexual practices can favor the development of conditions such as balanitis, balanoposthitis, urethral discharge, urethritis, as well as pelvic inflammatory diseases, which are very common in women. These conditions require immediate medical attention because they can lead to complications, pain, and discomfort for the woman's body. The fourth danger inherent in this practice lies in the development of fecal incontinence. Although rarer, frequent anal sexual intercourse can cause damage to the muscles and nerves of the anal sphincter. The anal sphincter is a type of valve that aids and assists in fecal continence, the mechanism of retaining feces in the body of men and women. When damaged, the patient may develop involuntary loss of feces, leading to anal incontinence. And lastly, the fifth risk associated with this practice is the onset or worsening of hemorrhoidal disease. As we know, hemorrhoids are nothing more than dilated veins. Perianal, anal, or rectal hemorrhoids can be worsened or developed with anal sexual practices due to increased pressure and greater damage to the local vasculature. Thus, patients may experience complications, aggravation of a pre-existing hemorrhoidal disease, or the development of it, causing pain, bleeding, and local discomfort. Now that you understand the real risks of this practice and how it can affect your sexual health, let me ask you a direct question. Do you feel that your performance is no longer the same? that your potency has decreased over time, or that you are not delivering everything you could during intimacy? Then do the following. Take a look at this video here. Point your cell phone camera at the QR code or click on the link in the description. There you will discover a 100% natural solution backed by science that has helped thousands of men regain potency, desire, and confidence, all in just 7 seconds a day. It's something so simple it almost seems like a lie. But when you watch it, you'll understand why so many people are calling it the #1 secret of male virility. Click the link in the description or scan the QR code and watch now. You will be surprised. If you found the content of this video interesting, if you think it will help someone you know, please share this information. Don't forget to subscribe to our channel. Activate notifications to stay updated on our weekly content. A hug, and until next time.